So I know that it's very quick, but just it gives you an overall an overview of the public health response in the first few weeks, days and weeks. And then I remember it was maybe in August. I was like, okay, job done. You know, I need to go back to my job because I love saying this term, disaster hangover. I had a kind of hangover. You know, I was like not sick of it, but I had like all my new job. I was new at my job, so I only had 3 days at my office, and then I've spent the whole summer in Lac-Megantic. So, you know, I needed to just go back to my other work. And then in September, maybe October, one public health physician that continued going over there in Lac-Megantic, she told me, Melissa, I don't know, there's something wrong with people over there. It's not about physical health. There's something with the mental health, and the local actors are telling us that they're very preoccupied by the mental health of the local community. So she was asking, what should we do? Which is a very good question, but I didn't have any idea of the answer at the beginning. So I've started a little bit reading, and most importantly, I started working with experts, because I think that in the face of such a unique event, you need to work in close collaboration with researchers, academics, you know, people that have been through similar events previously. We don't want to reinvent the wheel. So very quickly I've learned that disasters can affect entire communities and can cause significant losses on the human and material terms, and that, most importantly, the health problems, and more specifically mental health problems, can last over time. We're talking about months and maybe years, and can be substantial. And for that reason, one researcher convinced me to monitor, like she said, at least do some kind of study or survey, or try to monitor the mental health impacts to try to get a better diagnosis of what's going on over there. And I saw this figure, which I think is really informative. So, of course, in the first few weeks, you're not going to see so much mental health impacts, because we're talking about the heroic phase, and all the attention is over there, and you know, the media and the political leaders and the whole world was supporting people in Lac-Megantic. And then, at the end of August, as I did, all the people that were helping Lac-Megantic just slowly disappeared. And then people were left alone, and school just started in September, and people, you know, summer vacation was over, and normal life was resuming. And I think that's exactly at that moment that the disillusionment, I don't know how to pronounce it, but anyway, that mental health impacts started to be more strongly observed. And you can see with this figure that the peak of mental health impacts is usually observed between the 6th month and the first year, and it can last even more than that. And of course, like specific events like the anniversary can provoke specific reactions. So, as I told you at the beginning, I didn't know anything but maybe post-traumatic stress disorder, because everybody knows PTSD, and this is by far the most studied consequences of long-term impact of disasters. But I also learned that we need to take into account many other types of consequences, including depression, alcohol use, anxiety, and so on, and suicidal ideation, and even stress and psychological distress. So we need to look at the whole continuum, because people are not all going to be clinically ill, but they can suffer even if they're not ill from a physician perspective. Regarding PTSD, there's a very interesting literature review, not so recent, though I think it was published, I have it in my notes, but a few years ago. Interestingly, it looked at any types of disasters, including human-made. Most of the studies are based on 9/11. Technological disasters, which is the less studied type of disaster, and natural disasters, which is by far the most popular types of disaster studied. And overall, you can see that the proportion of people showing PTSD in the first year following any types of disaster is quite elevated. 30 to 40% among direct victims, 10 to 20 among rescue workers, and 5 to 10% in the wider community of an affected place. So I was not only curious, but I was just wondering, is it the same thing in Lac-Megantic? Is it worse? Is it better? Who knows? So we decided to conduct several recovery operations, but I'm going to focus much more on surveillance, monitoring, research, which goes a little bit together, as you're going to see, and after that, the community development and advocacy actions. But the third one came much later, after we got the results. And just, I'm not going to go through the other points, but occupational health, just to let you know that we developed some psychosocial workplace interventions among firefighters, for example. Health impact assessment was quite a key actions from a public health perspective, because regarding the downtown reconstruction and the questions of whether we should have a bypass railroad or not. So these key questions required a health impact assessment from the public health direction, so we've been involved into that, just to let you know. So the 3 health surveys. Okay, at the beginning, it's Danielle Malte. I need to acknowledge her. She's my, can you say mentor?
Yes.
Yeah? Okay, so she's my mentor. She's been involved in 2 major floods in 1996 in Quebec, deadly floods. And she's been learning a lot over the past 20 years. And I remember she called me maybe in August or September of the 2013. And I didn't know her, and she said, "Hi, my name is Danielle Malte, I'm a professor, and if you want to, I can support you if you want to do any research." And I was like, "Research? Well, I don't have time for research. I love research, but honestly, it's not the right timing, you know, I have my work to do." And then I was just thinking about it, and so I didn't say completely no. What I said is that we already had a population health study that was planned in my region. It was planned for summer 2014. So this survey was planned among all my local areas, including the Greenwich area. So we had the goal of recruiting 800 adults in each of the local areas. So I thought, okay, maybe we could add and include some of the questions proposed by Danielle Malte into our questionnaire. So, you know, it's not going to be too expensive, because you were talking about who's going to pay for that, and my first reaction was asking to the Ministry of Health, could you pay for a health survey? And they said no. So I didn't have any money for that. So I just included some of the questions of Danielle Malte into the first survey. And then when I saw the results, I said, okay, let's do a second survey 2 years after that. When you're going to see the results, you're going to understand why. And after the second survey, can you believe that we didn't got funded even after the first results from the first survey showing like very big issues over there. So the second survey, we did it very specifically to examine the impacts of the Lac-Megantic train derailment tragedy, and we paid for it because nobody wanted to help us. And the third survey, finally, with all the data gathered from the 2 first surveys, we were able to find a fund from the SHRC. It's like a federal organism that supports researchers. And Professor Malte is still working with me over there. Okay, so for each of the survey, which is pretty cool, is that we use the same measures. So the same exposure to disaster measures. So Danielle Malte is the one who proposed to look at 3 types of losses. What she calls objective losses, so material and human losses. So the type of questions like, did you fear for your own life or that of a loved one during that night? Did you lose a loved one? Or did you suffer injuries? Material losses, we ask them, have you been relocated? Have you lost your job, even temporarily? Or have you suffered damage to your home? That kind of stuff. And subjective losses, that's the type of questions I wasn't completely convinced about the relevance of. But finally, you'll see that it was very relevant. So it was about subjective, like the perception that the event would be stressful or harmful later or present prevented something important in your life or made you lose something important to you. So looking at these three types of losses, we were able to create this new variable, which is the intensity of exposure. So for the rest of the presentation, when I talk about intense exposure, it means that people were exposed to human losses, material losses, and subjective losses. Then moderate exposure is 1 or 2 out of 3 types of loss. And minimal means they didn't report any type of losses. And I'm not going to read them all, but we've been looking, at least in the first edition of the survey, to a wide range of health issues, including physical and mental health issues. But just to let you know that the questions regarding post-traumatic stress disorders were only added in the second year study. Because at the beginning, as I told you, I was not really convinced about the relevance of doing it. So I said yes to the questions on exposure to the disaster, but I said no to the question on PTSD. My mistake. Okay, so very quickly, just so that you get the big picture. So first of all, 1 year after the disaster, what we found out is that the exposure was very frequent at Lac-Megantic. And it's not only among Lac-Megantic people, but among the granite people. So we're talking about the whole area. And despite the fact that it's among the whole area, you can see that human losses were quite frequent. A lot of people said that they lost somebody very important to them, or that they feared for their own life, or death of a loved one. Material losses were a little bit less frequent. Subjective losses were also very frequent. And more interestingly, the intense exposure, so all 3 types, was still reported by 1 adult out of 6. 1 out of 6. So that was much more elevated than what I thought. Then what we did is we looked at these 3 levels of exposure: intense, moderate, and minimal or no exposure. And then according to these 3 levels of exposure, we looked at various mental health issues. So for example, anxiety disorder, as reported by the participants. You can see that anxiety disorder was affecting 3 times more participants in the intense exposure group as opposed to the unexposed group. So the difference was quite striking. Same phenomenon with alcohol abuse. So, and this differences was much more pronounced among men than among women. So among women, it was much more about anxiolytic drug use, and among men, it was much more about alcohol abuse. So you can see that alcohol abuse was 4 times more likely in the adults that were intensely exposed to the disaster. So okay, it's only 2 slides, but just this pattern was true for any mental health issues. So we went on a press conference and we disseminated these results, and people were surprised, yes and no. You know, we were kind of expecting some kind of impacts after 1 year. But the question is it going to be there next year? So my hypothesis was that no, it's going to improve for sure. You look at the figure. After 1 year, we've seen the worst, and then it's just going to improve over time. You want the answer? Okay. So anxiety disorder, in fact, it increased over time. Yeah. So I was shocked. I didn't expect that. Yeah, I was shocked. Then, the sense of insecurity. So we asked people, do you feel secure in your neighborhood? And of course, 1 year following the disaster, a high proportion of the victims, like the intensely exposed group, reported a high level of sense of insecurity. But what's the most surprising is that this proportion increased over time. So at the beginning I was surprised, and then when we think about it, that makes a lot of sense, because you know what? The train just went back from year 1 to year 2. So of course, they felt more insecure in their neighborhood. And then we finally added the questions on post-traumatic stress, which was a very good idea. So we don't have a comparison with 2014, but what you can see here, that's amazing. 75% of the intense intensity exposure group reported moderate to severe signs of post-traumatic stress. And maybe you could say, okay, but what about the general population? In Lac-Megantic as a whole, regardless of the level of exposure, it's 2 out of 3 adults in Lac-Megantic who reported post-traumatic stress signs. That's 2 years and a half following the disaster. Okay, so this was like the main result. I would say that the more shocking result for the community and for everybody, in fact. And what we realized is that while we were observing an increase in psychosocial needs and psychosocial impacts, we observed the reduction in psychosocial service use over time. So we had a main problem here, you know? And that's exactly what hospitals and clinics were observing. They were telling me, Melissa, why are you doing a second study? We know that the needs are going down. Nobody comes to the clinic, and you know the psychologists are not that busy these days. So according to my colleagues in hospitals and clinics, it was not really relevant spending the money, the state money for conducting such a study. But when they saw the result, they said, ooh, okay, well, we have a problem because where are these people? So 2/3 of the population suffers, but they're not at the clinic. They're not asking for any support. Then we conducted a 3rd-year study, and I'm going to go quick on this, but we've been doing a lot from year 2 to year 3. But still, you can see some kind of improvement in signs of post-traumatic stress, but not that much, huh? I mean, it's better than nothing, but we would have hoped larger improvement in the reduction of signs of post-traumatic stress. And in Lac-Megantic as a whole, we're talking about half of the population 3 years after that's still showing moderate to severe signs of post-traumatic stress.
Question?
Yep.
On all of the stress types, did you notice differences from when the trains were not running because of the damage to the town versus when the trains resumed running?
Yeah, I mean, we didn't evaluate the specific impact of this because I'm going to explain a little bit why we think that there was a deterioration in mental health over from year 1 to year 2. But additionally to the resumption of the train circulation, we had other secondary stressors that were going on all at the same time. So it's difficult to be really sure. But the sense of insecurity, to me, is a pretty good indicator because this is really specifically related, I think. And the question was not, do you feel insecure because of the train? But I mean, what else could explain this big difference across level of exposure? You know, in Lac-Megantic, there's nothing else. I mean, no criminals or nothing. No security issue, but the train. And the good news is that we observed a rise again in the psychosocial service use from year 2 to year 3, but there's still some room for improvement. So as a synthesis of our 3 studies, we could say that the psychological issues are very common in Lac-Megantic and surrounding areas. And you need to remember that they are common among direct victims, but among the wider community as well. So there's something more than the initial exposure that needs to explain this. We also noted that a large part of the population experienced losses and disruptions. A wide range of psychological impacts were observed, as we saw, and we noted limited improvement from year 1 to year 3. And we think that there's several factors that can explain this. First of all, we're talking about a human error. Okay, I'm not talking about the human like the engineer, but it's an accumulation of several humans. It's not a natural phenomenon. So this is much more difficult to accept and to make sense out of this, as you all know. And it's proven in the literature that technological disasters are much more harmful on the psychological health than are natural disasters. Natural disasters are still harmful, but a little bit less than technological ones. Then, of course, the losses were so concentrated in Lac-Megantic because everybody knew everybody. So this tightly knit community, this is definitely a strength of the community, but at the same time, it makes, higher degree of losses for the whole community. And finally, and I think it's really important to remember that, but the secondary stressors need to be acknowledged as well. So there's the initial stress for sure, but then the reconstruction of the city, one could think that this is a good thing, and this is a good thing, but it created a lot of tension among citizens, because I would say, just to give you an image, half of the population wanted to get their downtown as it used to be, and the other half wanted a new downtown, more sustainable, green, and all of this. So this tension, but that was a real big issue. Then the claim regarding compensation, it was going on, and people were waiting to know, are we going to receive a check? What's going to be the amount? And why am I receiving this amount? And my neighbor is receiving more than me. I was more affected than he was, so that kind of things. And when they received the check, it was another stress. What do I do with this money? Not most, but many of them just went to the bar, and the drug dealers made great deals. That's the truth. And the resumption of downtown train circulation, of course, was a big stressor. And on the top of that, there was a reduction, slow reduction over time of the psychosocial support. Because in the first year, the government was like, you want resources? No problem, take it. How many do you want? Then the second year, they were like, do you still need all these resources? You don't need all these social workers. And thanks to the first study, they said, okay, we're going to leave maybe half of the resources. And then after the second year study, they were like, oh, okay, maybe we're going to leave one resource. So, as time goes, it's more and more difficult to advocate for additional resources. But we work on it, and we have some good news.
Quick question. Was domestic violence included in the psychological stress?
I wish. We did. No, I know. I know, and you're not the first one. I've been giving seminar conferences several times, and that's not one of the official lessons learned, but in fact, this is one thing that if I could, I would go back and add these questions. Yeah. But the only thing is that I'm not sure if I should look at this, but is it validated to have questions on domestic violence when it's a phone survey? Because you call the woman at home, and so that's the only thing that I'm not sure it's the best way of collecting data on domestic violence. But anyway,
They might do it at trauma admissions.
Yeah.
Hospital admission.
Was there, and I have a question just though about anger in the psychological survey though? I thought I saw that somewhere, that there was an anger question along with the anxiety.
We had index, I'm not sure specifically about anger. I'll go back, because sometimes, to calculate an index composed of several items, maybe we had some kind of questions on anger, but I'm not sure. We had the questions on psychological distress, but nothing specifically on anger. Yeah, but it would have been interesting for sure. We had questions on, do you feel that you received the support that you needed? We had that type of question, but not on anger. And I'm pretty sure that there was some anger. And so the main issue for us was this paradox. So while help needs were persistent and even growing, the demand for psychosocial services has declined. So why? First of all, it support the population-based data rather than using clinic-based data if we want to monitor things, because the clinic-based data were telling us completely different things. So that's one thing you should remember. You need to advocate for survey rather than clinical-based data. Then we thought maybe this is related to insufficient or maybe more inadequate support, because we had additional resources, but there was no demand for it. And we think that was supportive of it was supporting the importance of outreach activities and flexible intervention. So we need to adapt as the situation evolves. So I'm gonna, yeah, we're still okay?
Yeah, we have till 7, everyone, just so you know, we need to be out
And
by
it's
7.
6, ooh, okay. Yeah, but still, since we're asking questions, okay. Because before going to our action plan, the main message that I want to share with you today is about, not about the SENDAI framework, and I'll talk about this later, but the importance of, as you said, of working with the community, of involving the community, and it can be from a public health perspective or municipality perspective or any kind of perspective. We need to stop doing things for communities, but rather working with communities. And really, that's my main learning. And since I've been working with the Lac-Megantic community, I think it changed the position I am. So everything that I do now on any topic, public health issue, anywhere in any part of my region, I try to do it this way, with the community, working with the assets in the community. And one of the frameworks that was by far the most helpful to help me understanding this is the SENDAI framework. So, except you, who has ever heard about the SENDAI framework? And that's okay, I know it's not enough now. I mean, almost nobody knows the SENDAI framework, but now I swear that you're going to know it and you're going to use it, because that's fantastic. That's exactly what you're advocating for. It's just that you're not aware that somebody wrote it for you. And this organization, it's United Nations. So that's a pretty good start. So as I said, it was adopted by United Nations in Sendai, which is a city in Japan, in March 2015. It was adopted by 187 member countries, including the United States. It was in 2015, huh? But it was adopted. And this framework is all about disaster risk reduction as opposed to disaster reduction, okay? Because too long we've been focusing on the disaster, on the event. If something happens, are we ready? So as I said many times today, the firefighter wants to extinguish a fire, and I want to make sure that the healed people are going to receive the proper services, and we all work in silos and we want to act on the event, and we're wrong. Basically what the SENDAI framework says is that we should focus on the risks and not on the event. And to fully act on risk, we need to understand this risk altogether, because I have my understanding, you do have your own, but when we all put it all together, all the sectors together, and all the levels of the society together, our comprehension of the risk is much better, and then only this way we're going to be able to act effectively. So that's a really interesting, okay, no. It's boring. When you read it, it's really boring. No, but honestly, it's a United Nations document. So maybe you may want to use the slides first, read it a couple of times, and if forget the pills to sleep, just read your SENDAI framework. And no, but it's a little bit hard to read, but yeah, you can use my slides. It's not a problem. So we're talking about resilience here, and I know that some people are just sick of resilience because we use resilience for any reasons, and we overuse the word resilience. Huh? You just have to put resilience into a sentence and you're a good political leader. But by resilience here, I think that the SENDAI framework talks much more about community resilience, so the empowerment of whole community rather than simply the individual. Okay, so this is quite a big difference. It's all about the process. How can we get stronger to resist and even prevent risk? Okay, so this is like the meaning behind the word resilience here. And they promote a multi-risk approach, and that makes a lot of sense. If we want to engage the community and empower the community, maybe it's it's one thing, because I know that you're all very concerned by rail safety, and probably that if you're concerned, it's because it's a real risk. But the best way to start the work would be to sit all together and say, okay, what are the risks in our community? Is it the floods? Is it the storms? Is it terrorist attacks? Is it the rail safety? Is it, I don't know, in the industry, anything? What are the risks? What are the vulnerabilities? What are our capacities? What are our resources? What are the exposure expected for each of these risks? And only once you've been through all these questions with all the expertise around the table, and by expertise I include citizens, because I think this is a forgotten expertise, unfortunately. So only when we have this common and shared understanding of the risk in a given community, then we can think about action plan and developing the right interventions. So it promotes all hazards approach, a whole society approach. So stop thinking by sectors, work all together, and all sectors approach, and all society, it means that with bottom up and top down approach altogether. And the 4 priorities are: first, we need to understand disaster risk. We need to understand them before, during, and after disasters. Before, we can identify many risks. During a disaster, we of course have to deal with many types of risks, and we still want to reduce their impacts. And after, in the recovery phase, we want to minimize the consequences in the long term. Then we want to strengthen our disaster risk governance. This is vital. Then we want to invest in disaster risk reduction and resilience reinforcement. And finally, we want to improve preparedness and building back better. So very quickly, I only have one slide for each, but you will have the occasion to go back to the slides. But I really like the first one. So the first priority, when I'm talking about understanding, I've been talking about this earlier, but we're looking at all the dimensions of risk, like vulnerability, capacities, exposure, hazard characteristics, environment, and this is useful before, during, and after disasters. So that looks obvious, but who really does that in a given community? Nobody does it. Well, not nobody, but not so many communities. The risk governance, this is capital, and this is needed at all levels. Most of the time, we have very strong governance at the Fed level, like if they were able to really manage what's happening in the communities on the ground. So we need very strong governance. And strong governance at the local level means a coordination of actions of all sectors, including the community actors and the citizens. And the third priority, risk reduction. So we need to invest in risk reduction, so in prevention and mitigation strategies to build the resilience of people, but as I said, the resilience of communities and of countries. We need to focus not only on deficits and needs, but on assets and resources. So what do we have as a community? What are our strengths, our capacities? How can we use and connect these capacities to be stronger in the face of a tragic event? And these measures are economically justified and vital for saving life, for preventing and reducing property losses, and of course, effective recovery. And the last one, preparedness. So that's how we're working on, but we need to increase disaster risk and the lessons learned from previous disasters. We need to be better prepared. That's exactly what you're doing today. You're interested in a previous disaster just to learn from us and just to get better, so that you're already applying the SENDAI framework, even if you don't know it. And I just want to emphasize 2 very important aspects of the SENDAI framework. So there's the knowledge and the community part. So regarding the knowledge, it's almost exact quote, but it's stated that it's very important improving the knowledge of government representatives at all levels through the sharing of experiences, lessons learned, and good practices, and through training and education programs. That makes sense, huh? It's also very important to ensure that local knowledge and practices are complete scientific knowledge. And I think that this is a main issue, because too often we put emphasis on the experts, scientific knowledge, but we forget about the local knowledge. You are the best, the more suited to know what's going to work and what's is not going to work, and all the technical aspects on the ground that needs to be taken into account if we really want the good practice to work on the ground. But I think we don't have any systematic approach to make sure that we take into account this local reality. And the empowerment of local authorities and community is very central to the SENDAI framework. So that's good for you and for all of us. And it's also very important to provide local authorities with financial means and regulatory means to help them acting in collaboration and coordination with the civil society. So that's a good news. United Nations basically is saying that to the whole world. So I think you should use these arguments to support your mission. And finally, there are some American documents that I found from the FEMA really stated very clearly that we need to work all together. So the sector interdependence is central to the resilience and recovery processes. So each system influences each other. So you know what I mean? So most of the time we talk about psychosocial recovery. So this is one part. And we need to work all together. Yeah, you're right. But at the same time, the economic development is another aspect that we need to work all together on. So the same actors need to be concerned about economic recovery, physical, environmental recovery, and psychosocial and human recovery. All of this goes together, and if we only focus on one or the other aspect and we forget one of these three central aspects, we're not going to get it.